All right, everybody. What's up? So, get that glare out of the way. What is that about? Okay. Trick to trigger finger. Let me get a glare out of here. Trick to trigger finger rehab. Okay. All right. So, um, if you need to follow me, I'm a physical therapist from Tampa Bay area. I got a clinic where I call it the Upfield Everything Clinic, and I get exceptional results in that patient population. I develop diagnostic methods, protocols. I've published them, and they are. Click the link below for clinicians only to my VIP free group, and you can read my papers that have statistically made medical history and readership and continue to every single year, getting multiple times even the biggest journals in the world. I have courses, I have mentorships, I teach, and I also teach people how to open and run these highly successful cash-based clinics, very different than everybody is teaching. Listen, and then for regular chronic pain patients, if you go to weltonmethods.com, click publications, you can get my papers, okay? Listen, trigger finger. Okay, so I don't see trigger finger that much in here. I just don't. I'm not a hand therapist. But when it comes to trigger finger, I was so curious because I published a paper called "Root Cause of Carpal Tunnel Syndrome." That was my last paper I published, showing a 3-step protocol plus a modified Phelan's test. Great test. Phelan, whoever your name, Phelan, whatever, bro. Nice work. Great test. I modified it though. And what I have found in carpal tunnel, but what I have is similar to what I have found in trigger finger. But we'll back up to carpal tunnel. So in carpal tunnel syndrome, years ago, I was sitting on a mat and this lady had carpal tunnel syndrome. And I'm like, I'm an obsessively curious person. I just have to know, right? So I'm like, and she had a release. She had a ligament release. Okay. They cut the transverse ligament or whatever. And it came back. And I'm like, how on earth did you have a ligament release and then it came back? Like, how did that happen? It doesn't make any sense, So I sat there and I'm like, where's this compression of the median nerve coming from? So what I did was I remember doing it with her, and I remember the patient. It was like, how long ago I go to PT? 15 years ago, we'll say. Something, I don't know. Like that. And what I did was I mobilized her wrist joint. And I noticed she had a tight posterior capsule. And I had an insight at that point, like an intuitive hit. And I'm like, what if the tight posterior capsule is pushing the carpal bones anteriorly, okay, causing a compression in the carpal tunnel? So I was like, yeah, she's got a tight posterior capsule. Let me, rebalance that, right? So I rebalanced that. And I gave her what is now my carpal tunnel protocol. And which you can get in my school group below. It's free. Join my free school group. Okay. You can join my advanced clinical mentorship and my cash-based business mentorship. For chronic pain patients, go to my website, wealthmethods.com, go to publications. Okay. So when it came to carpal tunnel, I mobilized and I fixed this person's tight posterior capsule. And then I also did a protocol with them, and boom, one after another, my carpal tunnel patients were getting better. And I'm like, oh, well, this for years, I've used that protocol. I don't remember the last person with a positive Phelan's test, or with me, my modified Phelan's test that I published. I don't remember the last person that didn't get better on my carpal tunnel protocol. Takes a while, but I don't remember it. Okay. And I don't feel worried when I see carpal tunnel in here. Now, okay, trigger finger. So one of the things that I don't see in here is I like puzzles, not regular puzzles. You won't find me doing that stuff, but I like this type of puzzle in here. I like medical mysteries. Okay. Um, I like the mental stimulation. And one of the things that I kept saying to myself when I was alone was, I don't see trigger finger. What's causing that? Like what, like, huh? Like why would somebody have a malfunctioning pulley system, right? So I don't see him that much. Okay. So I remember I had a patient about 3 years ago in that room, probably 3 years ago. And she had the triggering. And I wanted to see if she had a tight posterior capsule. Okay. And I'm like, well, what if that's causing it? What if the compression of the carpal bones, because of the tight posterior capsule, compression of the carpal bones is causing an abnormal pulley effect, causing this, that whole thing, right? So I tested the woman right then and there. And I was like, go ahead and make a trigger, right? So she's doing it, right? And I went like this. I find it doesn't work every time, but I went like this. And I did a posterior mope. And I'm like, now do it. Boom, it relieved it. I'm like, you joking, And I was like, really? She's going like this, right? I'm like, yes. I'm like, I figured that one out for that patient, right? More, and then I put these people on my trigger, like, which is similar to my carpal tunnel protocol, or the same. And I put on and they would get better. And I'm like, what if, just like in the ankle that I talk about, all these ankle and foot issues, what if the root cause of trigger finger in my patients was a tight posterior capsule? What if it was causing the carpal bones to move anteriorly and throwing off the pulley system? What if, Now, when I published that paper, I threw the carpal tunnel paper, I threw in trigger finger, okay? I can't say it's in every patient, but it has worked on all 5 fingers for me. So that needs to be studied more, my protocol. Anyways, those papers, click the free VIP group below, or go to wellmethods.com and go to join my mentorship. It's free. Okay. And then also my papers are in there for chronic pain patients. Please go to wellmethods.com and get on publications. Okay. This is a group for clinicians for us to discuss our challenges and our successes and all that. Okay. It's not for the general public. Somebody says that her son has windswept hand, was born with joint contraction, which we stretched out with braces and stretching. Right hand is good, left hand is windswept on their deviation. Yeah, a lot of times when people are born with something, though, I appreciate the comment. A lot of times when people are born with something, and it's a structural issue, like, okay, so there's 2 types of scoliosis, right? You got the scoliosis that happens when you're a teenager. And then you got the scoliosis that happens like, a lot of people with SI joints start walking around like this and they develop scoliosis. I'm like, stop that. Don't do that. I know why you're doing it. It hurts. Just don't do it. Because scoliosis are tough. I've had success with them, but they're tough. And but when it comes to like the ones at 13 years old, I'm like, when did it happen? Whenever I hear, a significant scoliosis, not the fact that they took an X-ray of my spine and said you have like a 5-degree scoliosis, uh, and I'm like, when did that happen? And scoliosis, they would say, oh, yeah. I'm like, when I was a kid. Okay, well that's different. Like that's a fixed deformity. I have no success in fixing that. I've had success in the and like a later on in life deformity. So anyways, that's that. Yeah, to the person Spring Tree Road, go on my website, weltonmethods.com, try to find a provider. If you can't, email my office and then ask them to ask her if there's anybody near wherever you live. one of my students, and maybe they can help since you don't live near me. Anyways, that's that. Now, so for clinicians only, please join my school group, okay, my VIP group. If you don't see it, like on TikTok, go to well10methods.com and join my free group. Now, listen, one of the things that people don't know about me, and I'm about to launch this massive program, okay, where where I have my mentorship, okay, my clinical mentorship, and I have my cash-based business hybrid clinical and business mentorship. Okay, so if you're just clinical, interest, then the clinical mentorship. We meet once a week. I give you 59% off all my protocols. So the kicker with me is I get exceptional results, but I actually created protocols. So like this is what I do in here, and then I teach people how to do that, and they replicate. So it's been very successful of people telling me that they've been able to replicate or close to it what I'm doing in here. So to me, you cannot, not to me, patients are bottom line people. Patient want results. They don't care. They don't care about your education. They don't care. They don't care about anything. They're bottom line people. They just want to feel better, right? Nobody cares where you went to school, what you graduated, what your GPA. Nobody cares. I've been in business 17 years. Trust me, nobody cares. And but because nobody thinks anybody's smart if they're not getting better. You know what I'm saying? Like, great, you had a 4.0 GPA. Nobody cares. Like, did your patient get better? Bottom line people, consumers, right? And so I've been, so I teach people how to open and run cash-based businesses as well. Okay. Now, this is very, very different. Very, very different. Okay. People say to me, what you're doing, Ryan, is impossible. Well, they said that about my clinical things, and I published it, and I proved that what I was doing wasn't impossible, because you were able to just try it. I've heard in no uncertain terms over the years that can't be done. The results you're saying you're getting that you published in those papers, can't be done in those patients. And I'm like, try it. That's why I published it, to help the world, right? Okay. People are saying to me, what you're doing in your cash-based business model can't be done. So when I go on Reddit, I look and people are like, oh, I make like, 100, 120, and one guy said that he was making in his cash-based business like 230,000. And everyone's commenting under there, that's impossible, that's impossible, that's impossible, right? And I'm reading it and I'm like, I don't know what that guy's doing. Everybody's got this traditional cash-based business, right? We try to convince people on the phone to not use their insurance. So they come in and you charge them, I don't know, $100 a half hour or an hour or 45 minutes or whatever you do. And then you're making it around what a physical therapist salary makes, right? Everybody was dogging this guy saying that's impossible that you're making 230 a year in his cash-based business. And I'm sitting there and I'm like making them, this is a 7-figure model I'm teaching. And the overhead's about 40%, do the math, and you work about 3.5 hours a day once we work up to the pricing. And people are like, that's impossible. Nobody pays that. And I'm like, listen, everybody's just fighting over the same patients. Everyone's fighting over the same patients. Like, oh, trying to convince people. If someone calls and they want to use their insurance, we tell them you should go use your insurance. There are patients that are desperate for people that have invested their time and their education in going deeper into advanced understandings of the body. Okay. And they will pay for that and they will thank you for changing their life after you do it. Okay. And I've been doing this like 17 years. Right. And I realized that the problem wasn't the economy, this, that, the other thing. The problem was actually me. And that I wanted to have this clinic here, but I didn't think it was possible. And I realized the problem was actually me. And I started just getting these people better using my protocols and my advanced clinical mentorship, using my protocols. And I started getting these people better that had failed everything. I call it the failed everything clinic. And because I hear it all day long. And anyways, so I started charging according like a lawyer would that gets, wins like most of their cases. Like they charge like $1,000 an hour, right? Nobody argues with them that they charge too much because there's a really good chance you're going to win, you know? So it's the same thing. And I teach people how to do that, but you just use my clinical methods and I mentor you on the clinical and the cash-based business side. If you think my methods are on point, the ones that you're doing from my papers or my Rehab results course or whatever, if you think a system is on point of like, here's what you do for this diagnosis type thing that I wrote up, I did the same thing for this cash-based business model. I developed a whole system, marketing, everything. And it's very different. And it's a seven-figure model I teach. Okay. One therapist, seven-figure model, working half a day. Join the screw group. I post the analytics of how I'm doing it. And people say that's impossible. And I'm like, no, it's impossible because you're doing what everybody else is doing, and you're treating the same patients that they're treating. So I hate that word impossible. I don't even believe in it. Anyways, that's that. All right. Other than that, peace. Love you all. Click the link below. Join my VIP group, and we'll see you in there for clinicians only. For patients, go to wealthmethods.com, and my publications are right there. And you can also join the group from there under my membership. Okay. Peace. Love you all.